Your cat is a master liar. She could be in real pain right now and you'd have no idea until it's too late. Here are the 10 signs she can't fake.
As a responsible cat owner, it's essential to be vigilant and recognize the warning signs that your furry friend might be sick. 10 key indicators that your cat may be unwell. Cats are masters at concealing their discomfort and pain, often making it challenging for owners to identify when something is amiss. The well-being of your feline companion is not only a matter of their physical health, but also their emotional and mental state. When cats are unwell, they may experience stress, anxiety, and discomfort, which can affect their overall quality of life. Furthermore, untreated illnesses can worsen and lead to more severe health complications, potentially endangering your cat's life. By recognizing the warning signs of cat illness early on, you have the opportunity to provide prompt and appropriate care, improving your cat's chances of recovery and ensuring their comfort. This not only helps maintain their physical health, but also contributes to their emotional well-being, ensuring a happy and contented feline friend. Changes in eating habits. Decreased appetite. A decreased appetite in your cat can be one of the early warning signs that something isn't right. Cats are known for their finicky eating habits, but a sudden and prolonged disinterest in food should raise concerns. Several factors can lead to a decreased appetite, including dental problems, digestive issues, or underlying illnesses. To monitor your cat's appetite, keep track of their food intake and consult your veterinarian if you notice a significant decrease. Prompt attention to this issue can help identify and address the underlying cause before it worsens. Increased thirst. If your cat starts drinking more water than usual, it could be a sign of an underlying problem. While cats do vary in their water consumption, a noticeable increase in thirst may indicate issues such as diabetes, kidney disease, or hyperthyroidism. Make sure your cat has access to fresh water at all times and monitor their water bowl. If you find that your cat is drinking excessively and more frequently, it's advisable to consult your veterinarian for a thorough evaluation. Weight loss. Unexplained weight loss in your cat is another important warning sign. While weight fluctuations can occur due to various factors, such as changes in diet or activity levels, significant and rapid weight loss should not be ignored. Weight loss can be linked to numerous health conditions, including diabetes, hyperthyroidism, cancer, or gastrointestinal problems. Regularly weigh your cat and consult your veterinarian if you notice a noticeable and unexplained drop in their weight. Cats typically do not drool excessively, so if you notice your feline friend drooling excessively, it may indicate an issue with their oral health or gastrointestinal system. Dental problems, such as gum disease or a foreign object stuck in their mouth, can lead to excessive drooling. Additionally, nausea or stomach discomfort can also cause drooling. Examine your cat's mouth for any foreign objects or signs of oral health problems and consult your veterinarian if the issue persists. Lethargy and inactivity. Cats are generally known for their playful and active nature. However, if your cat becomes unusually lethargic and inactive, it could be a sign of an underlying health problem. Lethargy often accompanies many illnesses, including infections, organ dysfunction, or pain. Keep an eye on your cat's activity levels and seek veterinary attention if they seem consistently lethargic or lack interest in activities they once enjoyed. Hiding or withdrawal. Cats may seek solitude or hide occasionally, which is often considered normal behavior. However, prolonged hiding or withdrawal from social interactions can be a cause for concern. Cats sometimes hide when they're feeling unwell or experiencing stress. If your cat hides excessively and avoids contact with family members, it's crucial to investigate the cause. Gradually coax them out of their hiding spot and observe their behavior. If they continue to hide, consult your veterinarian for a thorough examination. Aggressive behavior. Sudden aggression in a cat can be alarming and may indicate underlying discomfort or distress. Cats can become aggressive when they're in pain, feeling threatened, or experiencing fear or anxiety. If your cat displays aggressive behavior that is out of character, it's essential to assess the situation carefully. Rule out external stressors and consider consulting a veterinarian to determine if there's a medical reason behind the change in behavior. Addressing the root cause can help alleviate the aggression. Vocalization changes cats communicate through meowing, and they often have unique vocal patterns. Changes in vocalization can provide valuable insights into your cat's well-being. For instance, an increase in meowing, particularly when accompanied by distress or discomfort, may suggest pain or anxiety. Conversely, a sudden loss of meowing or a change in tone could indicate a problem with their throat, mouth, or vocal cords. Pay attention to your cat's vocal cues and seek veterinary advice if you notice significant alterations in their meowing habits. Grooming habits. Overgrooming or lack of grooming. Cats are meticulous groomers, and their grooming habits can provide important clues about their health. On one hand, overgrooming, where a cat obsessively licks or chews at their fur, can be a sign of stress, skin irritation, or allergies. If you notice your cat developing bald patches or sores due to excessive grooming, it's essential to identify and address the underlying cause, which could range from skin parasites to psychological stress. Conversely, a lack of grooming or a disheveled appearance can also be concerning. Cats that neglect grooming may have mobility issues, dental pain, or other health problems preventing them from self-care. It's vital to observe your cat's grooming habits and their coat's condition, seeking veterinary advice if you notice any significant changes. Fur matting or disheveled appearance. Fur matting or a consistently unkempt appearance in your cat's coat can be an indication of underlying issues. Mats in a cat's fur can occur due to a variety of reasons, such as mobility issues, obesity, or long hair that's not adequately cared for. Mats can lead to skin irritation and discomfort. Regular grooming and addressing the root cause of matting are essential for your cat's well-being. If your cat's coat appears consistently disheveled despite grooming efforts, it may be a sign of illness or pain, preventing them from grooming themselves properly. In such cases, consult your veterinarian to rule out underlying medical conditions and to establish a grooming routine that suits your cat's needs. Frequent urination or straining. Changes in your cat's urination habits can indicate various urinary tract issues, including infections, blockages, or bladder stones. If your cat starts urinating more frequently than usual, has difficulty urinating, or exhibits signs of straining while in the litter box, it's essential to take these symptoms seriously. Failure to address urinary problems promptly can lead to severe health complications. Consult your veterinarian to determine the cause and receive appropriate treatment. Diarrhea or constipation. Alterations in your cat's bowel movements, such as persistent diarrhea or constipation, can be signs of gastrointestinal issues or dietary problems. Diarrhea can result from infections, dietary changes, food allergies, or underlying diseases. On the other hand, constipation can be caused by dehydration, dietary issues, or blockages. Monitor your cat's litter box habits and consult your veterinarian if you notice consistent diarrhea or constipation, as these issues can lead to dehydration and discomfort. These indicators related to grooming habits and elimination patterns can provide valuable insights into your cat's overall health. Being attentive to these signs and addressing respiratory issues, coughing or sneezing. Respiratory problems in cats can manifest as coughing or sneezing, and these symptoms can indicate a range of issues. Common causes of coughing include respiratory infections, asthma, or allergies. If your cat develops a persistent cough, it's essential to consult your veterinarian for a thorough examination and diagnosis. Similarly, frequent sneezing may be a sign of upper respiratory infections, allergies, or foreign objects in the nasal passages. These issues should also be promptly addressed to ensure your cat's respiratory health. Labored or difficult breathing, often characterized by rapid breathing, open mouth breathing, or a noticeable effort to breathe, is a severe sign of distress in cats. It can indicate a critical medical emergency, such as heart disease, lung problems, or even a blockage in the airway. If you observe labored breathing in your cat, it's crucial to seek immediate veterinary care. Delaying treatment in such cases can have serious consequences for your cat's health. Oral health problems, bad breath. Foul-smelling breath in cats, often described as fishy or rotten, can be a sign of oral health problems. Dental issues such as gum disease, tooth decay, or mouth infections can lead to bad breath. Ignoring bad breath in cats can result in pain and further dental complications. Regular dental care, including professional cleanings and at-home dental hygiene, is essential to prevent and address oral health problems. Drooling and pawing at the mouth. Excessive drooling or pawing at the mouth may indicate oral discomfort or injury. Cats may drool if they have a foreign object stuck in their mouth, mouth ulcers, or dental problems. If your cat suddenly starts drooling excessively or appears to be in pain while pawing at their mouth, it's crucial to inspect their mouth carefully and consult your veterinarian for an accurate diagnosis and appropriate treatment. Maintaining your cat's oral health is essential for their overall well-being, and early detection of oral issues can prevent more severe problems. Skin and coat abnormalities, rashes, sores, or bald patches. Cats are generally meticulous in grooming, but if you notice unusual skin conditions such as rashes, sores, or bald patches on your cat's skin, it's important to investigate. These abnormalities can result from various factors, including allergies, parasitic infestations, like fleas or mites, dermatitis, or underlying health conditions. Inspect your cat's skin regularly, especially if they scratch or groom excessively, and consult your veterinarian if you discover any concerning skin issues. Flaky, itchy skin in cats can lead to discomfort and affect their overall well-being. Dry skin can result from environmental factors, allergies, or dietary deficiencies. If your cat exhibits persistent itching, scratching, or develops dandruff-like flakes in their fur, it's advisable to consult your veterinarian. They can determine the underlying cause and recommend appropriate treatments or dietary adjustments to alleviate the skin problem. Eye and ear issue. Discharge from eyes or ears. Excessive discharge from your cat's eyes or ears can indicate various health problems. Watery or pus-like discharge from the eyes may signal eye infections, allergies, or foreign bodies irritating the eyes. Likewise, ear discharge can be due to ear infections, ear mites, or other ear issues. Regularly inspect your cat's eyes and ears for any unusual discharge, and consult your veterinarian if you notice persistent or concerning discharge. Excessive tearing or squinting. Excessive tearing or squinting in cats can be signs of eye discomfort or problems. Cats may squint or blink excessively due to eye pain, sensitivity to light, or eye infections. Tear staining can also occur, resulting in dark-colored streaks under the eyes. If you notice your cat squinting, tearing excessively, or showing signs of eye discomfort, schedule a veterinary examination to diagnose and treat any underlying eye issues. Early detection and prompt treatment of eye and ear problems are crucial to prevent potential complications and ensure your cat's comfort. Temperature abnormalities, fever, or hypothermia. Monitoring your cat's body temperature can provide valuable insights into their health. A cat's normal body temperature ranges between 100.5 degrees Fahrenheit to 102.5 degrees Fahrenheit, 38.0 degrees Celsius to 39.2 degrees Celsius. Temperature abnormalities, such as fever or hypothermia, can indicate underlying issues. Fever. A fever in cats is usually a sign of infection, inflammation, or another underlying condition. Common causes include viral or bacterial infections, inflammation, or heat stroke. If your cat's temperature rises above the normal range, it's important to consult your veterinarian for a thorough examination and appropriate treatment. Hypothermia. Hypothermia occurs when a cat's body temperature drops below the normal range. It can result from exposure to cold weather, wet fur, or underlying health problems. Hypothermia can be life-threatening and requires immediate attention. If your cat shows signs of shivering, weakness, or cold extremities, seek veterinary care promptly. Monitoring your cat's temperature at home can be challenging, so it's essential to recognize signs of fever or hypothermia, such as lethargy, shivering, or unusual body temperature, and take appropriate action accordingly. Recognizing the 10 warning signs that your cat may be sick is crucial for maintaining their health and well-being. Cats are experts at masking their discomfort, so as responsible cat owners, it's our responsibility to be vigilant and attentive to any changes in their behavior, appearance, or habits. By paying close attention to changes in eating habits, alterations in behavior, grooming habits, elimination patterns, respiratory issues, oral health problems, skin and coat abnormalities, eye and ear issues, and temperature abnormalities, you can provide timely care for your feline companion. Remember that prompt veterinary care is essential when you observe any of these warning signs, as early intervention can often lead to more successful treatment outcomes. If you have any further questions or need additional information on any of these topics, please don't hesitate to reach out to your veterinarian or explore more resources on bdvets.com.